Hi, I'm Dr. Woeller for the Candida Mastery Course. This course is a very in-depth analysis on the different aspects of chronic candidiasis. So if you think about Candida, right, sometimes we think, well, that's just kind of a simple problem. Somebody's got a little bit of overgrowth in the digestive tract, or they've got oral thrush, for example, and we can just give some botanicals, maybe change their diet around, and all will be good. Well, the problem is that Candida is a very complex, sophisticated organism that has various ways that it can become invasive in the body and cause problems. Now, conventional medicine recognizes Candida as well. They often look at it primarily from a standpoint of oral thrush, something seen in newborns or elderly individuals, or perhaps a skin infection. And they do recognize something called candidemia, which is a systemic infection from Candida. But what often gets missed in conventional medicine is well recognized and extremely important in functional and integrative medicine, understanding that the different chemicals that Candida produces can lead to a host of problems, contributing to things like autism, autoimmune disorders, depression, chronic fatigue, chronic allergies, etc. If we think of just the overgrowth of Candida in the digestive system, at a surface level, it might just increase food sensitivity or bloating or gas or lead to some other kind of intestinal discomfort. But these organisms, as I mentioned, are highly sophisticated. Candida, for example, can produce different proteins that allows it to become invasive within the mucosal lining of the digestive tract, not only compromising immune function in the gut, but infiltrating the lining of the gut, disrupting the tight junctions, leading to leaky gut, and being a trigger for autoimmune reactions. Through a protein called invasin, Candida can actually incorporate itself into the epithelial cells. And it can trigger a broader immune reaction by interacting with certain immune cells that exist in the gut and beyond. The other thing that these organisms do is they produce certain aldehydes. For example, arabinose is a type of chemical that gets produced from the invasive nature of Candida. And arabinose is not only a reflection of invasive Candida, but arabinose itself can interact with different nutrients. So it can create imbalances in B6 and biotin, for example. And these aldehyde chemicals are many times toxic themselves. In fact, much of the phase 1 liver detoxification pathways are there to help break down different aldehydes. Acetaldehyde, for example, is a chemical compound that's produced because of the overgrowth of Candida and the metabolism of yeast cells in general with regards to glucose. Acetaldehyde can get produced, and it has its own toxic effects, causing membrane disruption, mitochondrial dysfunction, reactive oxygen species production, oxidative stress, free radical damage, etc. So this course looks at all of that and more. So we look at a variety of different pathogenic mechanisms. We look at where chronic Candida can be linked to different types of chronic health conditions, as I mentioned. So autism, autoimmune, depression, anxiety, mental health, neurological problems. And we can even take a look at Candida's relationship to certain types of cancer. We go through an analysis of different ways of assessing for Candida. What is the difference between what you find on a stool test, an organic acid test, and a blood test? What are some of the pros and cons of each? We look at different treatment modalities, from medications and their mechanisms of action, to botanicals, to dietary intervention, to looking at a diversity of probiotics and trying to improve upon the microbiome status. What do we do in scenarios where, through our best efforts, right, people are following diet, they're taking the supplements, they're taking the botanicals or other antifungals, but Candida just keeps coming back. It's just a recurrent problem. What then? What's going on? We take a look at the different variables that can lead to a chronic, ongoing Candida and yeast problem. We also look at how Candida relates to other organisms in the digestive tract. Clostridia, for example. A lot of people think that the only Clostridia bacteria that's important in the gut is Clostridia difficile, but there are other types of Clostridia that can be problematic. Parasitic infections, and then even the existence of mold and some of the mycotoxins that mold produces. How can that relate to an underlying Candida problem? So I encourage you to take a look at the information on this website. If you have any questions about the course, you can reach out to us through the email linked to this website. One of the other things about this course, like our other mastery courses through Integrative Medicine Academy, is we have a forum for ongoing questions and answers. We also have pre-scheduled Q&As. These are live Q&As that questions can be posted, and we also present information. We'll go through test analysis, case studies, for example, and a host of other educational information as well. There are course exams, and then once you're completed with the course and have passed the exam successfully, there's a certificate of completion that states you've gone through this course and mastered its material. I think you're going to find this course incredibly interesting, challenging, and very clinically relevant to many types of patients you're probably already seeing in your practice and that you have questions about. So again, look through the website. If you have any questions, just reach out to us and we'll get those answered for you. I'm Dr. Kurt Woeller for the Candida Mastery Course. Thank you.